Tudor.
Hey, Lauren, here we go again.
It's wonderful. It's great to start ISC 24.
Absolutely.
So what are you most excited about?
I mean, it's hard to say what I'm not excited about. I'm really very excited about this year's program, starting with late-breaking abstracts. The plenaries will have, we had just counted the phase 3 randomized trials. There's 12 of
12.
them,
It's
12,
amazing.
it's incredible. And variety of topics, not only thrombectomy like before, although we have some great thrombectomy trials too. The Brazilian trial in the extended time window with just CT and aspect scores, inclusion criteria. But beyond that, there's some incredible trials, of course. There's 3 randomized trials, phase 3 trials for middle meningeal artery embolization in subdural hematoma. I actually don't know the results, but I hope this will be another watershed moment, just like
Game-changing potentially.
2015 for thrombectomy. There's the Golden Bridge trial, which is to me is very futuristic. We're in the future now, and that is an AI-based trial. Well, AI versus humans in devising the best treatment plans for prevention of secondary stroke prevention. So that's incredibly
with huge patient numbers.
With
Really
huge
incredible.
patient numbers. And many others, IV thrombolysis of all flavors in all time windows, in acute stroke, tirofiban,
New neuroprotectants.
new neuroprotectants. We have another very futuristic abstract at the plenaries. Can AI, just our smartphone, tell us what the patient's NIH stroke scale score is? I mean, stuff that we would have dreamt about 5 years ago. It's now reality.
Yeah. And done and completed and ready to be presented.
Absolutely.
Which is just thrilling.
I'm also super excited about all the brain health abstracts and presentations and late-breaking science. Along those veins, I'm super excited about us having as part of the SED talks, Dr. Ramon Estruc from Barcelona, who led the PREDIMED, the Mediterranean diet trial for cardiovascular prevention. And of course, he's going to talk to us about how Mediterranean diet works in preventing stroke. So that's something that I highly recommend to everyone to attend and maybe heed those advices ourselves, right? There's, of course, the large core session that I think is going to be very exciting. A lot of exciting presentations on the consequences of the immunotherapies for Alzheimer's disease.
Yeah, the area studies.
The ARIA studies and how that is going to impact us as stroke physicians. I will let you comment on the basic science section, which you have so masterfully designed and overseen. And
well, we have now, again, for the second year in a row, 3 bench to bedside and beyond sessions, which is really meant to bring together the basic scientists and the clinicians around a topic. So we have pediatric AVMs, stem cells, and cerebral microcirculation. So that's fantastic. And then we have some basic science and neuroprotection in the plenaries. I think really trying to get to highlight some of the more advanced, well done studies there. There's the STEP platform session as well, and indeed quite a showing from the basic and translational scientists across all of cerebrovascular health.
Yeah, so as I said, I'm excited. There's going to be so much to absorb and so much to learn about new things, cutting edge science. I specifically did not look or try to find out all these new trials that are being presented, because I like to be surprised.
Surprised at the plenary.
At the plenaries, yeah. I hope there will also be time for socializing and getting together. That's another big component of this meeting.
Well, the poster sessions and moderated poster sessions are great for that too, right? To catch up with old colleagues, see science, and see science presented by the trainees
Absolutely.
in the abstracts and the posters.
And we do have some, just like we started last year, that those sessions have been a success. There's sessions that are geared and designed specifically for trainees to have the opportunity to present here and hone their presentation skills, and that has been very popular.
You're talking about the interesting cases.
The interesting cases,
where you
yes.
don't have to have a scientific presentation, but you can pull the most interesting case you've seen and submit it. Those are great.
Absolutely, and they really liked it. That was the feedback that we received. We have the stroke in live conditions for the ones who are interested in how a thrombectomy case actually occurs, what actually is being done
All
there,
the
just concretely, and then on the hemorrhagic side, how aneurysms are coiled and AVMs are treated and things like that. So those are very exciting sessions and also have been very popular. I cannot emphasize enough how important is the feedback that we get from the participants, because that makes the conference better. Right. And the debates are always the favorite among the ones who submit their ideas. We have Game of Strokes, of course, another perennial favorite.
Indeed. It's quite a mix, right? And things in every domain, right? Bringing together nurses, podiatrists, advanced practice practitioners, the neurosurgeons, interventionalists, neurologists. So again, we're launching and look forward to the start of ISC 2024.
Buckle up and enjoy the ride.